You are watching this video because your child is scheduled to have a central venous catheter, also called a central line, put in. The purpose of this video is to explain what a central venous catheter is, how the catheter is inserted, what it does, and how to take care of your child's catheter. If you have any questions after watching this video, please ask your child's central line care nurse. A central venous catheter is a slender, hollow, flexible tube that is inserted into the arm or chest through the skin into a large vein. The doctor has chosen a central venous catheter so that the healthcare team can deliver fluids, nutrition solutions, antibiotics, chemotherapy, or blood products directly into your child's bloodstream. The catheter can also be used to collect blood samples so that the healthcare team doesn't have to collect blood with another needle. The doctor will choose one of the following catheters based on your child's needs: Mediport, PICC, or Broviac. The central venous catheter will have one lumen or multiple lumens based on the therapy needs of your child. A Mediport or Broviac catheter is inserted during a simple surgery. During the surgery, your child will be given a general anesthetic so that they can sleep through the procedure. For a Broviac, one end of the catheter is placed through a small incision in the neck. This is called the insertion site. The catheter is threaded carefully through the large vein in the chest. The other end of the catheter is threaded through a tunnel beneath the skin and will come out of the chest through another incision called the exit site. A Broviac catheter has a cuff that is buried under the skin. The cuff keeps the catheter in place so that it won't move around or get pulled out of the body. The cuff surrounds the catheter to prevent infections. The catheter will be stitched at the end to help hold the line in place until the skin grows around the cuff. These stitches usually dissolve or are taken out by a doctor. For a Mediport, one end of the catheter is placed through a small incision in the neck or insertion site and threaded carefully through the large vein in the chest. A pocket is created for the port to sit in and closed with a few stitches. You might feel or see a slight bulge under your child's skin where the port is located. Sterile dressing will be placed over the port to prevent infection. After the procedure, the insertion and exit site is covered with special pieces of tape called Steri-strips. Steri-strips will fall off once the sites are healed. The procedure to insert a peripherally inserted central catheter, or PICC, can be done in a procedure room or at your child's bedside depending on the child's age and development. The child will receive a numbing medication on the skin where the PICC will be placed, and additional numbing medication right before the catheter is inserted into the skin. The child will also receive sedatives or relaxing medications during the procedure. A child life specialist will be there to help comfort you and your child and help your child understand what is happening. The PICC will be threaded into a vein in the arm above the bend of the elbow and guided into a large vein in the chest. The catheter is fixed onto the skin with a securement device and covered with a sterile dressing. For an infant, a PICC may be inserted into the arm or leg. After the procedure, the child might feel mild soreness around the insertion site. While your child is in the hospital, special wipes called chlorhexidine gluconate, or CHG wipes, will be used once a day to wipe down your child's skin. These wipes help prevent infection and remove any germs from the skin. Your child's nurse will instruct you how to use the CHG wipes. These special wipes will not be used once your child is at home. Thank you again for choosing Cleveland Clinic for your care.